Hi, my name is Isaac Chimbugwe. I'm a Red Cross first aid instructor. Today, we are going to talk about CPR. What is CPR? CPR is a first aid procedure that we give to somebody, a casualty, who's found not breathing. Many different scenarios bring about not breathing. For example, when we are involved in accidents, when we are involved in accidents like car crashes, jumping from heights, and other things, poisoning, and many other conditions. When is CPR given? CPR is always given when you find somebody not breathing, not responding, not saying anything, meaning they're unconscious. How do you check that somebody is not breathing? We check that somebody is not breathing by using a mechanism called the LLF, the look, listen, and feel. I will look at the chest of the casualty to see whether it is going up and down, up and down. I'll hear the sound of the breath with my ear, and I will feel the warmth of the breath around my pinna. That can tell me clearly whether the person is breathing or not. When I find out that somebody is not breathing, I will call an ambulance. I will call an ambulance, tell them my name, where I am, the condition of the casualty, and what I need from them, and that is the help or immediate referral. And I will still notify them that I'm giving CPR. I will put my hands between the chest of the casualty. That is where the sternum is, between the nipples. Then I will compress the chest 30 times with a rhythm. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 20. 1, 2, 3, 4, 5, 6, 7, 8, 9, 30. I give the 30 chest compression. After, I will blow into his mouth 2 rescue breaths. 2 rescue breaths. The chest has to rise up and then down. Rise up and then down. I continue with the process until when the ambulance arrives or when professional help comes in, or still if a medical practitioner comes in. But first thing should be when the casualty regains the breath. If they regain the breathing or they respond by breathing, I stop the CPR and put them in a recovery position. That is when the ambulance arrives and refer to the hospital. CPR is cardiopulmonary resuscitation. This mechanism helps to remind the heart plus the lungs that the heart has to pump blood in circulation, and the lungs have to be reminded that they have to exchange the gases. That is why we compress the chest 30 times and give kiss of life 2 times, which we call the mouth-to-mouth resuscitation, the rescue breaths, or the artificial ventilation. Remember, when somebody has got an accident, let us not converge around the casualty. Let us give the casualty space. Many casualties die because they lack fresh air around the scene. And many of them die because the first responders moved them wrongly from one place to another. Others die because of a compromised airway. They might fall in a wrong position where the airway is blocked and nobody is around to help them. All people are around but don't know what to do. Everyone can help somebody with a compromised airway. Just put the person, lie on their back, open the airway by tilting the head and lifting the chin. Somebody will be having an open airway and will be breathing freely. If you are in position to give CPR, don't put your mouth directly on the casualty's mouth. It is not safe. Casualty might be having some infections, or the first aider might be having some infections. and there might be cross-infection. Casualty, first aider. Get something like a polypen, put a hole in it, blow without your mouth touching the casualty's mouth. Or if you have something like this is called a mouth-to-mouth resuscitation device. It is used to blow in air into the casualty's mouth. Put on the casualty's mouth, it will create a barrier between you and the casualty. You will blow in, and you will not get any diseases. If you're sure that you have nothing to use to protect yourself, the mouth from the casualty's mouth, just stick with the external chest compression. Just stick with compressing the chest 30 times. Compress the chest as you check whether the person has started breathing. Compress, check. Don't give the kiss of life if you are not safe. Above all, we do not give first aid if we are not safe. Your safety comes number one as a first aider. Always mind about your safety at the scene before you do anything.